I'm Masaki Matsuzaki, a psychiatrist. I received this question from a nursing student. As a psychiatrist, what do you keep in mind when talking with patients with mental disorders? That's a good question. Now, this is quite a broad question, and it covers many aspects. For example, things like make proper eye contact when talking, or listen carefully, understand what the other person is saying, and respond empathetically. There are textbook points like these, as well as various techniques and approaches. Well, today I'll just talk about one part of it. First, when thinking about talking with patients with mental disorders, in most cases, some kind of diagnosis has been made by a psychiatrist. If the patient has a diagnosis, it's important to understand the specific points that require caution for that particular mental disorder when communicating with them. I don't expect the general public to do that. However, for those working in healthcare, it's desirable to engage with patients after learning about each mental disorder. For example, in the case of schizophrenia, there may be delusions. When it comes to those delusions, it's not appropriate to deny their content, nor is it appropriate to affirm it. What matters is acknowledging that the delusion exists. As for the feelings related to it, irritation, anxiety, sadness, and so on, those are the emotions we should empathize with. In the case of obsessive-compulsive disorder, such as repeated checking or cleaning, you should engage with the patient in a way that avoids getting involved in their compulsive behaviors. In this way, it's necessary to properly learn the basic approaches specific to each mental disorder. So I hope nursing students and medical students study this thoroughly. And now, I'm going to say something that may sound almost contradictory, but even if there is a diagnosis, the one in front of you is not a disease. It is a person. Ultimately, you are talking to a human being who is suffering from an illness. Someone who is struggling because of the disease. How was this person born and raised? What have they experienced? What do they value in life? It would be good to have conversations that help you understand the person in these ways. When thinking about understanding the person, don't aim to hear one thing and know 10. When you hear one thing, consider what could correspond to 2. If possible, imagine several possibilities, and then check what is actually the case. By taking an interest in people and continuing to do so, that interest leads to a sense of compassion. Showing interest in someone means acknowledging their existence. Of course, the illness itself is important. As a psychiatrist, when running outpatient sessions, I inevitably have to talk with patients within a limited time. As a result, the conversation tends to focus only on the illness. Even so, the illness is, for that person, only a single page. Just one page in the book of their life. It would be good to take an interest in other pages as well, and be able to understand the whole person. I suppose so. For now, as a psychiatrist, how I approach psychiatric patients and what I keep in mind, that's what I've talked about. Well, I say all this, but I can't always respond in an ideal way.
If any of my patients see this, I don't think that's really the case, they might say. If so, please forgive me.
I suppose so.
That's all.